One of our biggest fears for men as we age isn't just losing strength, it's losing our sharpness. So today we're talking about mental sharpness as we age. I'll break down 5 things that science says you can do to protect and even improve your brain health as you age. So let's get stuck in. Why mental acuity declines? If we're not sure what we mean by acuity, I mean sharpness and cognitive function and your just ability to function as you get older. Now, it's normal as we age that our brains are going to lose neurons day after day. And actually, we do. So, the neurons are little connectors in your brain that keep everything linked and allow you to live. But as we get older, those neurons start to die off. And they will literally start doing that from puberty onwards and sometimes even before. But what we don't want to do is have a decline that is so significant that it affects our quality of life. And once it gets to a severe level, you're going to notice more than just things like, I can't remember where my keys were, to full on dementia or Parkinson's disease or other problems that can affect your quality of life. And at worst, even end things earlier than you'd want them to be. Treat your brain like a muscle. Think of your brain like your pecs, and you wouldn't want to walk into the gym, load the bar up with the best ever bench press weight you've ever done and expect to crush it after years of doing nothing. So the same applies to your mental performance, and you have to train it. If your daily mental routine is just watching daytime TV, you're not going to give your brain that stimulus it needs to grow or maintain itself. But here's the good news. Mental workouts don't have to be complicated. Tomorrow morning, you could do a Sudoku or do a crossword. You could start learning that language that you've been talking about doing for 6 years but never did. Pick up a book on a subject you know nothing about. Research shows people who consistently challenge their brains stay sharper for longer. And it's not just about being clever. Like, these actually make a difference and they make new connections in your brain. And whether it's work, hobbies, volunteering, or mentoring, the key is to just keep learning and keep stretching your mind. Find a purpose. So this one's often overlooked, and purpose isn't just about motivation, it's a protective factor for your mental health and cognitive function. As a doctor, I've seen countless stories of high-performing professionals, surgeons, executives, entrepreneurs who retire, lose their primary sense of purpose, and then decline rapidly. One of my surgical mentors was the perfect example, who, after decades of passion for operating, then retirement came in with no clear plan, and within 2 years he'd passed away. Now, we'll never know, obviously, if this was directly relating to his losing his purpose, but we do know this: humans are wired to need meaning, and without it, we risk not only depression, but also cognitive decline. So, even if you're working now, think about those hobbies or skills or the projects that you could pick up now that will give you a sense of purpose outside of work, so they'll serve you well in later life. Smell something. So, the more senses you use in learning something, the more your brain is involved in retaining memory. So, do you ever walk past some freshly cut grass or smell some food cooking and get an instant reminder of a childhood memory? Well, this is because smell is directly linked to the part of the brain that forms memories. There was an interesting study done where adults were shown a series of emotionally neutral images, so just plain images, and whilst also being presented along with the smell. They were not asked to remember what they saw, but later they were shown the same set of images back, this time without the smells. They were then asked to indicate which ones they had seen before. The ones that had been paired with an interesting odour had a much better memory recall. And this makes sense because if you want to increase your memory, involve your other senses. It's simple stuff. If you want to learn a language, for example, listening to it as well as reading will help you improve your memory. If you want to remember a list of facts, then go into the garden, smell the environment while you're studying, and this will help your memory. The more areas of your brain you can stimulate, the more memories will take shape. Maximize your brain's blood flow. If you improve blood flow to any organ, it's going to be more healthy. And this is because the increased blood will carry more oxygen, more nutrients, and will take away more waste products and carbon dioxide. We know that if you narrow or reduce the blood flow to your heart, for example, you end up having angina or worse, a heart attack. The same rules apply to your brain. And if you narrow the blood supply here, this eventually results in a stroke. But a stroke's a pretty blunt and hard endpoint, and obviously most of us won't suffer a stroke, but we may suffer with the microscopic adverse effects of having less good blood flow to their brains. And this is where physical activity is the key. You can improve your mental health and function by doing this, and it's not just physical activity, but other things you would normally do to keep your heart healthy too. So just to summarize, this would be exercising regularly at least 3 or 4 times a week, keeping your blood pressure within normal limits, making sure your cholesterol is low, not smoking, minimizing alcohol intake, and avoid being significantly overweight or having type 2 diabetes. I mean, this is all the same rhetoric that we tell patients to do to reduce their risk of heart disease, but it has the same benefits for your brain. In patients that have this sustained microscopic damage to multiple parts of their blood supply to their brain, they develop a condition called vascular dementia, which in many ways mimics other forms of dementia like Alzheimer's disease, which most of us have heard of. But the difference here is that this is not the same cause as Alzheimer's, and is actually due to tiny little blood vessels supplying parts of your brain being progressively damaged by all those risk factors we just talked about. And vascular dementia, unlike Alzheimer's disease, is entirely preventable because you can do all those things we talked about in terms of your physical health to keep your brain just as healthy and also cared for. Don't confuse mental acuity with mental health. I see a lot of men 50 plus who are worried that they're developing dementia because they can't remember where their keys are, or maybe can't remember the names of the staff that work with them. I mean, I'm not sure I remember all the staff that work with me either, but even in worse cases, they can't remember what they did last week. And this might be a sign of decreased mental acuity or a decline in cognitive function, but it might also just be that you're distracted. So if you're stressed or you're worried or your mental health is suffering, then you don't devote the time and effort to concentrating on a task. And you need concentration to form memories. Men are not always great multitaskers, and I know that's a generalization, but if you're otherwise distracted, then you'll never devote the brain power you need to remember what you need to do. If you want to do something about this right now, just ask yourself 2 questions. How is my mental health, and am I in the place I want to be going forward? If, on reflection, you think perhaps your mental health is not great or not as good as it should be, then maybe take some time to reflect. Perhaps take a break from that stressful environment if you can. Even try talking to someone who might make a big difference. Secondly, when was the last time you had a health check? Medical problems such as underactive thyroid, low testosterone, vitamin deficiencies can all cause changes in mental health, concentration, confidence, and the ability to form memories. So it might be that it's time to get your hormones and general health looked at. The take-home message here is don't worry if your memory doesn't seem great, as this may well be something you can correct. If you want to do something about this now, ask yourself 2 questions. How is my mental health, and am I in a place where I want to be going forward? If, on reflection, you think perhaps your mental health is not as good as it should be, then maybe take some time to reflect. Perhaps take a break from a stressful environment, or even try talking to someone, which might make a big difference. The take home is don't worry if your memory doesn't seem great, as this may well be something you can correct. Mental sharpness isn't about one magic habit. It's about consistent, intentional care for your mind and body. Challenge your brain, protect your purpose, engage your senses, optimize your blood flow, and take care of your mental health. If you do these, you won't just avoid decline, you might find yourself sharper than ever, even as the years go on. Thanks for listening to Man Alive. I'll see you next time.